This week's Ask Dr. Durie is from a questioner asking about the constant search for new and better therapies for myeloma. This gentleman correctly points out that the last big change-making drugs, as this questioner says, game changers, were VELCADE and Revlimid. So bortezomib, VELCADE, and lenalidomide, Revlimid. These were drugs introduced in the last 10, 15 years which really changed the whole outlook for myeloma. This was a transition from the old type of chemotherapy that we used to use to treat myeloma, the melphalan-prednisone, the VAD chemotherapy, over to these new novel agents, the proteasome inhibitors, the IMiDs. And this is definitely a very good example of what you would call game-changing therapy. And so the use of Revlimid and VELCADE combined with Dex really produces some of the best results that we can achieve with myeloma therapy at the present time. And so the questioner says, well, what about the next game changers? Are we seeing other game changers right now? Or what do I see as possible game changers coming down the pike? Well, I would have 2 or 3 answers to this. Number one, I think that we do need to look closely at the differences between carfilzomib, trade name Kyprolis, versus VELCADE. And so Kyprolis is another proteasome inhibitor, but I would point out that it does indeed give deeper responses versus VELCADE, and when used in combinations with Revlimid or pomalidomide, can achieve both frontline and relapse remissions, which really are significant with improved and prolonged survival. And so I would say that Kyprolis, in the form of the KRD regimen, the Kyprolis, Revlimid, and Dex, or Kyprolis combined with pomalidomide and Dex, these are game-changing regimens which really are making an impact in both the frontline and the relapse settings. But what about new agents? Are there new agents which are going to make a really big difference and totally improve survival outcomes? Well, I don't know yet. We have this very exciting monoclonal antibody, daratumumab. Now, this is the anti-CD38 monoclonal antibody. Very exciting results even as a single agent. So given alone to patients with relapse refractory myeloma, daratumumab, trade name Darzalex, this produces responses in about 30% of patients. Now, the question is, how sustained will these remissions be? If we start to use daratumumab earlier in the disease, as is happening in a variety of trials, will this really improve the ultimate outcome for myeloma patients? It's just too soon to know. And so this is an important part to this question, which is that it does take time to know if something will turn out to be a game changer. The VELCADE and Revlimid were introduced 10, 15 years ago now, and so now we do know with the survival outcomes that these are game changers. Other new things that are coming along which are clearly different and could be game changers are the use of the CAR T cells. Now, these are T cells which are removed from the patient, undergo genetic engineering, and are given back to attack the myeloma. These T cells can really, in some cases, produce dramatic benefit. And there is one lady who is really a poster child for this approach who has had a dramatic response following treatment at the University of Pennsylvania under the direction of Dr. Carl June. This T-cell approach against CD19 has produced amazing benefits, sustained for over 2 years at the present time. Another approach which could turn out to be dramatically beneficial, a game changer, is the use of virotherapy. And this is coming from the work of Dr. Russell at the Mayo Clinic in Rochester, who has pioneered the use of a measles vaccine virus type approach and also a new virus approach using VSV, vesicular stomatitis virus. These engineered viruses can produce dramatic benefit. And again, there is a lady who has been the poster child for this approach and has had dramatic benefit in remission now 2 and more years later. And so those are a couple of examples. But in closing, I would say what we really need for myeloma research right now is an effort to identify game changers. What I mean by that is that there are always treatments that maybe can produce a little bit of added benefit, but I think we really need to more highly prioritize the search for true game changers that can really make a big difference. This is what we really need. And so in that sense, I greatly appreciate the question this week for someone who is really looking for that. And obviously, patients are looking for that. They can see that they can get a little bit of benefit here or a little bit of benefit there. But what will make the difference for patients in the longer term is to have a new game-changing therapy. And so as physicians and researchers, we need to honor that and search more diligently for these new game-changing approaches.